Hey, future nurses. Welcome back to your NCLEX question of the day. Today, we're tackling a high-yield neurology case, perfect for the next generation NCLEX. Can you put these interventions in the right order? Let's find out. A 45-year-old male is admitted after being found unconscious at home. Upon assessment, the patient has pinpoint pupils, a respiratory rate of 6 breaths per minute, and a Glasgow Coma Scale of 6. Which of the following actions should the nurse take first? Arrange the interventions in the correct order. Administer naloxone IV push. Apply oxygen via bag valve mask. Obtain a stat ABG and call the provider. Check for a gag reflex before intubation. Assess for a history of opioid use. Pause here, think about it, and comment your answer below. Let's see how many of you get it right. Time's up. The correct sequence is B, A, C, D, and E. Let's break it down. B. Apply oxygen via bag valve mask. The patient's respiratory rate is critically low, only 6 breaths per minute. Without immediate ventilation, hypoxia can lead to cardiac arrest and brain damage. Oxygen first. A. Administer naloxone IV push. Pinpoint pupils plus respiratory depression. This screams opioid overdose. Naloxone reverses opioid effects and may restore spontaneous breathing. C. Obtain a stat ABG and call the provider. We need to assess CO2 levels and acidosis severity. If the patient remains acidotic, pH less than 7.25 and CO2 greater than 60 millimeters of mercury, mechanical ventilation may be needed even after naloxone. D. Check for a gag reflex before intubation. This step is only done if the patient is still unresponsive and in respiratory failure after naloxone. We need ABG results first to guide intubation decisions. E. Assess for a history of opioid use. This is useful, but not a priority in an emergency. The patient's symptoms already suggest opioid toxicity. How did you do? Drop a comment below if this explanation helped. Don't forget to like, subscribe, and turn on notifications for more NCLEX practice.